Welcome to Joy Recovery Radio. In this space, we talk about betrayal, recovery, and relational harm through the lens of integrity, accountability, and trauma-informed care. Our goal is not to rush healing or prescribe outcomes, but to offer language, clarity, and grounded perspective. This podcast is educational, not therapeutic. You're invited to listen slowly, take what resonates, and leave the rest. Let's begin.
Hi, everyone, and welcome to Joy Recovery Radio. I'm Jacqueline.
And I'm Roy. Today, we're going to take a look at the Deceptive Sexuality and Trauma model called DST model, sometimes called the Minwalla model, and his framework where he describes 22 different types of trauma that the betrayed partner can experience. And the one that he added last is what we're going to focus on today, Trauma Room 22, called Treatment-Induced Trauma.
And as we know, there are 3 documented dimensions of harm in the DST framework. So you have the covert phase, you have the exposure phase, and you have the symptom progression phase. Most people have done work in this space are familiar with the early and middle injuries. So for instance, Discovery Trauma Room, which is room 5, the Disclosure Trauma Room, which is room 6, and room 7, which is the Reality Ego Fragmentation Room. Those rooms get talked about a lot. But room 22, the last room, does not. And that's part of the problem. So if you're a partner listening, a woman who has sought help and walked away from that session feeling more shame, more self-blame, more confused than when you arrived, this episode is for you. There's a name for what you may have experienced, and it matters that you hear it.
We've had so many people come into our coaching practice who have had this form of trauma, unfortunately.
At least 1 out of, I would say, every 2 or 3.
Yeah, it's more common than most people realize. This concept clinically is not new. As far back as the late 2000s, there was recognition that sex addiction treatment models could re-traumatize the betrayed partner. And this began showing up in the literature right after the year 2000.
Mm-hmm.
And then Dr. Minwalla released a paper in 2012 that named what he called the co-addict or co-sex addict paradigm, that it was a form of diagnostic mislabeling that would perpetuate the harm by calling the betrayed partner a co-addict.
And what most people don't know is Trauma Room 22 was the last room that Minwalla added. So it was an addition after he had already published the secret sexual basement document.
Mm-hmm. So here is the clinical definition that we're going to use today. And this is drawn directly from the writing of Dr. Minwalla. Treatment-induced trauma is a clinical intervention that causes harm to the patient or client. Traumatic consequences ensue from the clinical interventions or from serious clinical omissions that is perpetrated by the professional helper.
You just said a phrase, Roy, where you said serious clinical omissions, and I want to be sure that we don't rush past that. Because it's not only about the professional doing something harmful, it is also about a professional failing to do something necessary. A professional who does not see the abuse system cannot name the abuse system. A professional who does not have the category of reality ego fragmentation, they can't treat it. Their not knowing is not neutral. Their not knowing has clinical consequences.
And that's really the difficult, uncomfortable truth about all of this in this episode, is that most treatment-induced trauma this is not being caused by helpers who have some kind of malicious, ill intent. These are well-meaning helpers who are simply operating from frameworks that don't have the diagnostic categories to see what's actually happening to the betrayed partner.
So here's a line I want partners to write down. If the professional's map does not include betrayal trauma, the professional will point her in the wrong direction every time. So, how do you know if you've been exposed to room 22? Well, I'm going to share a few statements based on real testimonies that were reported from betrayed partners. And some of these are things that I've been told as well.
And these are really tragic. These are really sad.
They are. So the first one, therapy made me feel more crazy, not less. I was treated like I was the problem for responding to his behavior, his abusive behavior. My therapist told me I needed to work on my codependency instead of focusing on his lying. A spiritual leader told me I needed to forgive quickly and stop holding on to resentment. I was told my anger was the problem, not the betrayal and deception. They said if I were more emotionally available, he wouldn't have acted out. I was encouraged to look at my part in his behavior before I even processed what had happened. I was labeled as controlling for asking for transparency after discovering years of deception. I was told I was traumatizing him by bringing up the truth. I was told maybe if I would spice things up in the bedroom, he wouldn't have acted out. These messages don't just hurt, they destroy, and they distort reality.
So before we get into the specific patterns of treatment-induced trauma, we want to pause for just a moment and tell you where this conversation today lives within the larger work that we do. Everything we're covering today is part of the framework at the Joy Recovery Academy. The DST framework, the trauma rooms, the distinction between sobriety and integrity, the sequencing of real recovery for both the betrayer and the betrayed. These are not topics that we drop into a podcast and then move on from. These are the ground level material that we teach live, twice a week.
There's also a full replay archive if you can't make it to any of the live teachings. The same framework we use with our private coaching clients you can find within the Academy. For more information, visit joy-recovery.com.
You could join, learn, and leave at any time. So let's get into the patterns now, shall we? Here is the structural problem with traditional sex addiction treatment. And we want to be very careful how we say this. We're not condemning anyone that is trained in that model. But the model does have a structural limitation, and it can produce real harm. It's really organized around one central question. Is he sober? That's the metric. The metric is abstinence from the sexual behavior. So recovery is measured in chips and meeting attendance and the duration of the sobriety streak. What that model cannot see, because it doesn't have a category for it, is the DCSR, Deceptive, Compartmentalized, Sexual Relational Reality. The secret sexual basement is what it's called. The system of abuse. That the sexual behavior was just a visible symptom of an invisible system. The architecture that produced it and sustained it, such as compartmentalization, covert reality, gaslighting, entitlement, image management, that architecture is the injury. And sobriety doesn't dismantle any of it. It doesn't even touch it.
Mm-hmm.
What we're saying is a man can be completely sober and still be operating a covert psychological reality.
Yep.
He can be doing step work doing 90 meetings in 90 days, making calls with a sponsor, and simultaneously continuing to hold on to secrets, withhold information, try to shape your narrative,
Yep.
manage her perception of events. The secret basement does not require sex to remain active. The deceptive system runs independently of the acting out behavior. So for a professional who only has sobriety as a metric, this man looks like he's recovering. He has his chip. He's doing the work. The model they use say that he's good.
Mm-hmm.
But to the informed eye who's familiar with the DST model, the covert architecture is still intact.
Yep.
And the partner is still living inside of a manipulated reality.
And that part breaks my heart when I hear these stories from partners. It's like she's watching him do all the right things. Like you said, he's going to meetings, he's talking about his recovery, getting support. But internally, she feels like something is wrong. And we will question our intuition. And for some partners, our gut is still very much activated and we can't let it go. However, the professional is telling her that recovery is happening and he's doing what he needs to do. So she must be the problem. It's her fault, and she's the one who can't get past it. So she must be the one who's broken. There becomes triangulation in this, where the betrayed partner will feel that the betrayer and the professional are ganging up on her. And her body is telling her something feels wrong. It doesn't feel right. But the two of them are saying it's all in her head.
So when you're working with a helper and the framework they use is sobriety-centric, then that framework can produce what's called treatment-induced trauma for the betrayed partner. And it's not because anyone was trying to cause harm.
That's right.
It's because the framework is asking the wrong diagnostic question. Their framework is asking, is he sober? It is not asking, is she safe? Those are not the same questions. They're not even close to the same question.
I'm glad you pointed that out because there's a difference between the traditional model and Minwalla's model. The traditional model focuses more on sobriety, where the Minwalla model focuses more on safety. A betrayed partner has got to feel safe asking questions. She's got to have some autonomy about making decisions about her own life, her own body, her own future, and whether the relational environment she is living inside of is honest.
And that's why we start with pillar 1 in our framework with the men, which is integrity. And we've been clear about this in all of our content, that sobriety is not the same thing as integrity. A man has not established integrity simply because he has stopped the sexual behavior. Integrity requires the dismantling of the entire system of secrecy, the omissions, the minimizations, the gaslighting that constituted the integrity abuse towards his partner. Integrity is the foundation, it's the prerequisite, and it cannot be claimed on the basis of a sobriety date. They're not the same thing.
No, they're not. And that's a really good distinction because if the professional is operating without that, if they do not know that integrity and sobriety are different clinical categories, they really can't help the person who's in this dynamic.
They can't help either person, really.
No,
Yeah.
they can't.
They can help him count days of sobriety, but they can't help him become safe.
And they can't help her know whether she is safe.
That's right. That's right. So let's pause and let's talk about one specific pattern that's in this space. We see it in our work all the time.
Often, yeah.
When a partner begins to work with a professional, whether that's a therapist, a couples counselor, sometimes even a CSAT or a coach. She is showing up and presenting with a specific set of symptoms. It's usually hypervigilance, intrusive thoughts. She's very dysregulated. She often has a lot of difficulty sleeping, maybe even eating. She has episodes of rage that feel completely unlike her normal self, periods of numbness or dissociation, and deep, profound confusion about what is real.
You know, a professional who does not know the DST framework will look at those symptoms and see a presenting clinical problem, like something to diagnose and manage. And they may label it as generalized anxiety. Some professionals may use codependency as the framework. And in some cases, partners have been evaluated for borderline features because of the emotional dysregulation that they feel.
Why is this happening? Because that helper didn't have a category to understand where those symptoms are actually coming from. This isn't a mood disorder. This isn't a personality disorder. This isn't depression or acute anxiety. This is trauma. And the origin matters. The symptoms are actually very appropriate responses to the specific injury that she's experienced. And that is what the DST framework gives us. It's a way to understand the partner's symptoms, that they are not a pathology, that it is a rational, coherent, expected, documented response to a psychological injury that was done to her. When the diagnosis misses that, I guarantee the treatment's going to miss it too.
Absolutely. And the specific injury that gets missed most often is called REF. So that's the reality ego fragmentation. If you're familiar with our podcast and the Academy, we talk about this part a lot. The reality ego fragmentation, that's when the partner's pre-existing reality, the life that she understood to be living, the life that she thought she had, collides with the secret sexual basement. So her entire cognitive and emotional framework for understanding herself, her relationship, her reality gets completely demolished and shattered. That collision is a specific trauma event. It's not just emotional pain. It is a structural fracture and the self's ability to hold a coherent reality. So, if your professional doesn't know what REF is, they can't help you reconstruct from it. And they can't offer emotional support. They also can't validate the pain you're in. But the specific targeted work of the reality reconstruction, stabilizing the shattered pieces, establishing what is true, rebuilding firm ground to stand on, that work, it requires a professional who understands what happened to you and your reality first and foremost.
That's right. And that is where, in the DST model, we find the second brain injury. That is the partner's enteric system, your second brain, which is located in your gut, your intuition. It was registering that something is off long before the basement was exposed, sometimes for years. Your body knew something was wrong. Your body was producing signals. And those signals were constantly being overridden by your partner. He would gaslight you. He would cause you to question your own perception. When exposure happens and you find out about the basement, the partner has to reckon not just with the betrayal, but with the fact that her own body was right this whole time. And she was trained by him not to trust herself. That is a profound internal injury, and it needs to be recognized and treated.
Do you mind if I take a second just to talk about codependency?
Oh, you've got to. Yeah.
Okay. So I want to do this because I know that the codependency model is still widely used in this whole betrayal, trauma, infidelity world that
Space.
we live
Yeah.
in. Yeah, this
Yeah.
space. And for most of us, I'm going to say most because I don't want to use absolutes, I would have not agreed to enter into a relationship with you had I known that there was this sexual basement, that you were living this completely separate life, that your life was drenched with deception and manipulation.
Hmm.
I went into this relationship completely blind to all of that. Knowing and finding out after doesn't make me codependent. And so when betrayed partners are labeled as codependent, it absolutely drives me nuts. It's this co-sex addiction framework and codependency model that often will ask partners to examine their own patterns as contributing factors in this relationship dynamic. And the language sometimes includes, well, it takes two to tango. And let me just say, when those frameworks are applied to a partner who has been the victim of integrity abuse and systematic reality manipulation, it causes immense harm.
Mm-hmm.
Now, I'm not saying that the partner has no internal work to do. We have our own recovery journey that we need to embark on.
And it's not the same as his work.
No,
It's completely different.
no, but for a partner who is already experiencing damage to her enteric system, who already has a deeply under who is already deeply uncertain about her own perceptions, who has been conditioned by years of gaslighting to doubt her own instincts, does not need a professional directing her to examine her role in this dynamic. That is, to me, that's a continuation of gaslighting.
It's more gaslighting.
It is.
And this time it's from someone with credentials.
That
Yeah.
you trust.
Yeah. And so this episode is us just publicly going on record that any intervention from any professional that blames both people and the relationship as the cause of deception and integrity abuse, that is a treatment failure. And that is causing unnecessary trauma. For a betrayed partner to reach out for help and instead be harmed is one of the most serious violations that a professional could commit. So we do not believe that for the betrayed partner, her expected survival responses in the wake of trauma should be labeled codependency.
Absolutely not.
If she is seeking information to restore her reality, if she's asking him for the truth, transparency so that she can feel safe,
Mm-hmm.
if she's hypervigilant because now the world is just not a safe place, and that's what trauma does to a victim, her asking questions to get oriented is not a pathology. It's what we would expect any trauma victim to do. So calling those things codependency, it does four things. It silences her legitimate needs. It shifts blame onto the victim, the injured partner. It protects the deceptive instead of protecting the truth.
And it deepens the trauma with shame and self-doubt that she has.
Absolutely. So I've been dreading this part of the episode. It's one of the hardest things to even reflect on. But we want to be clear, because to soften this or to omit this would be its own form of harm. So here it is. We have seen professionals who actually collude with the betrayer. Sometimes they're not fully aware of it. Sometimes they are. Sometimes they're genuinely believing that they're being neutral. But functionally, they have become part of the covert operation. Let me define what I mean by collusion in this context. A professional colludes when they function to protect the betrayer's ability to keep deceiving his partner or to continue operating from a partial truth. Here's what it looks like in practice. It has a specific pattern. First pattern is this. The professional advises the betrayer not to disclose certain information because, and this language is almost always used to justify it, this is going to harm your partner. So the professional has just made a unilateral decision about what information the partner has a right to receive about her own life. And they have appointed themselves as the arbiter of what she can handle. And that is a violation of what we call partner sovereignty. Why don't you say some things about what we mean by partner sovereignty?
So, partner sovereignty is a foundational concept in our framework, and it's where a partner has the right to accurately know information so she can make real decisions about the relationship, about her safety, and about her future. What it doesn't do is, well, it eliminates professionals deciding on her behalf. So for an example, some professionals may say, well, this is what you should know, and these are things that you shouldn't know. And they'll deem it as, I'm protecting you. Well, not always. They could be extending the original injury, and they could be colluding with the deception. Listen, I might not agree with all of the questions that some of the betrayed partners want to ask, but I don't have the right to tell them that they shouldn't ask those questions. We can vet those questions. We can break them down. I can probe and say, is this something that you really want to know? Is this going to be helpful for your recovery? But I dare not say to someone, you can't ask that question. That's not my right. And I definitely don't want to cause any additional injuries to someone whose reality has been totally destroyed.
I've seen on multiple occasions CSATs that have told their clients, the betrayer, I don't want you to tell your partner the truth right now
Oh my gosh.
because I'm afraid of what it's going to do to you. I'm afraid that your sobriety isn't strong enough, that your ego is too fragile to handle this right now. So let's get you more stable. Let's get your sobriety secure. Let's continue working 3-6 months, and then we can look at you possibly coming clean with your partner. That's what I mean by colluding with the betrayer to deceive the betrayed partner. With the men that I work with, if I find out that there is active deception going on, I tell them, you must tell her. You must tell her now, or we're not going to be able to work together anymore. Now, a second pattern where the helpers actually collude as part of the deceptive system is when they will move the couple, both parties, towards relational repair before the betrayed partner has accurate reality yet. And they'll say, well, this is a relationship problem, not a reality problem. And let's focus on the relationship. So let's work on your communication skills. Let's focus on rebuilding your intimacy and your connection. That might sound reasonable. It may sound like legitimate help. The problem is you can't do relational repair on a foundation of lies. It's a false foundation. If she doesn't have accurate reality yet, it's not safe for her to give her heart to this person again. And any work done in that space is being done on a structure that the partner can't actually see yet. And when the truth does eventually surface, and it always does, all of that quote unquote repair work that they were doing, it collapses. It meant nothing. And she now has the additional experience of being told that she was getting better, that the relationship was getting better, all the while she was still being deceived and nothing was getting better.
This is why sometimes we say it's best to hold off on deep couples work before disclosure. So, when a professional wants to move towards relational dynamics before the deception system has fully been dismantled, whether they know it or not, they're asking the partner to be emotionally vulnerable with someone who is still operating a covert psychological operation against her. So you're asking someone to let their guard down, to be vulnerable with someone who is not safe. It's not a good time for couples work, because what happens is that sort of structure is just going to expose the betrayed partner to ongoing harm. And it often leads to triangulation. So triangulation is where either the betrayer and the professional end up agreeing with each other, and then the betrayed partner feels attacked.
And that's a good segue into the third pattern, because it's very similar to that, where the professional will begin to validate the betrayer's story
Yep.
as if it's the truth, because that's his client or that's her client. And so they'll say, well, you're working so hard and you're making so much progress, and it's the betrayed partner that's having difficulty now moving forward. And so the professional who's working with the betrayer receives his narrative as the story.
Yep.
And the betrayed partner's voice is not in the room. They don't have her experience. They don't have her lived reality. And they don't work from a framework that would prompt them to ask her, what observable change have you experienced? What have you noticed? What have you observed in him? Not what he self-reports, but what has she witnessed? And the partner finds herself in the position of having her lived experience outweighed by the betrayer's narrative. And now with a clinician who is attaching his credibility to the story from the betrayer.
That specific experience of having your reality contested, not just by your partner, but by a professional, is one of the deepest and most common forms of trauma room 22, which is treatment-induced trauma. You came to a space to have your reality validated, but instead, the professional in the room is now adding weight to the story of what you sensed and you felt and you know is inaccurate. And you're sitting there and you're reliving it and trying to make sense out of nonsense. Now, we want to be careful not to leave this episode as simply a list of what's wrong with how professionals operate. That is not our purpose or intent whatsoever. Roy and I know some of the best professionals, and we actually have gained so much value and insight from them. But what we want to talk about is what the DST-informed approach will require from a professional.
So what do I look for in a professional so that I'm not a part of this room 22, this treatment-induced trauma? The first thing you're going to notice with someone who is informed with deceptive sexuality trauma is that professional is going to ask him about structure. It's going to focus on not just his behavior, whether he's acting out or not just, what did he do, but the system of deception, how it was organized, what did he withhold, over what period of time, what tactics did he use to maintain this deception. It's a system. It's an architecture. A professional who is not familiar with deceptive sexuality is only going to focus on behavior and not the structure underneath.
The second, and this is one I watch for most, is how does a professional position the partner's injury? So, for example, is her trauma understood as an appropriate response to abuse? Or is it pathologized as a reaction that needs to be managed independently of its cause? A DST-informed professional will recognize hypervigilance, dysregulation, disorientation, and they'll be able to see the impacts on a partner.
Third thing you can look for is a professional who does not move prematurely towards relational repair, and they are waiting for true safety and shared reality to be demonstrated. They're not going to offer couples work until the individual work is established, and especially until the betrayed partner feels safe enough and ready for that. They're not going to prescribe connection until the deception has been fully dismantled. And the metric they use to see whether it's safe or not is observable change, not self-reported change, but observable change where the betrayed partner's voice is part of that feedback. What is different that she can actually validate and verify?
And one of the practical questions I encourage every partner to ask herself after a session: 1, do I feel more connected to my reality or further from it? I'm going to add a second one. Was my reality validated? So many times during sessions I have with partners, they will ask, am I crazy?
That's true.
And it's heartbreaking because to the outside world, they feel judged and they feel crazy, but they're not. They are living and trying to survive through one of the most painful things they've ever experienced in their entire life. Having that validation and feeling connected to your reality will tell you more about the professional than any credentials that he or she may have hanging on the wall. So in closing, treatment-induced trauma might be the last documented dimension in the DST framework, but for most of the people listening, and for myself, it was one of the first rooms I walked in when I tried to get help. The instinct to reach out for help is the right thing to do. Just know when you do that, you deserve a professional whose map includes the territory you are standing in, which is betrayal trauma.
And that's why joy recovery exists in the first place. And that's why the DST framework is the ground that we work from. And it's why conversations like this episode today has to happen. It's uncomfortable. It's not easy. But these things have to be identified and addressed.
And if this episode resonated, if you heard something today that helped you name an experience that you've been carrying, we want to know. Reach out to us at joy-recovery.com. If you feel you're ready to go deeper, look into the Joy Recovery Academy. We cover a lot of the structure work that we went through today during our live teachings. So with that, we're going to close and remind everyone that joy is possible
when you live in integrity. Thanks, everyone.
Thank you for listening to Joy Recovery Radio. If today's episode was helpful, you can find additional educational resources and information about the Joy Recovery Academy and our private coaching at joy-recovery.com. Remember, joy is possible when you live in integrity.